Hi guys, welcome back to Nursing Guru. Myself Manoj. Today again I came with an important topic, that is the breastfeeding, which is most important topic that covers under the child health nursing as well as the OBG, right? So which is a basic thing. Wherever you go, breastfeeding, it has to be a known concept. As a nurse, as a medical student or a nursing student, whatever it may be, the breastfeeding or a breast milk or the concept related to the weaning, breastfeeding are correlated. This is a must and should topic that every nursing student has to know. So let's discuss in detail about what is breastfeeding, that is everything. Starting from the definition, we are going to see the definition of breast milk, breastfeeding and exclusive breast milk or breastfeeding. Okay, and next we will be seeing the physiology of lactation, and third we will be seeing the techniques of breastfeeding along with the types of breast milk. What are the types of breast milk? And next the initiation of breastfeeding, when need to be initiated with the breastfeeding, until when. Okay, the duration of the initiation of breastfeeding should be done when. These are the things we are going to discuss, and also the techniques of breastfeeding, as well as in detail we are going to discuss the advantages of breastfeeding. Okay, why I am stressing this point is this is a very repeated question that comes in your theoretical paper as well as the viva questions in the practical examination. Okay, and finally the seventh topic, the subtopic we are going to discuss in breastfeeding is the factors inhibiting breastfeeding. So these are the 7 subtopics we are going to cover under the breastfeeding in today's topic. Okay, let's move one by one, starting from the definitions of breastfeeding. Okay, so before moving to breastfeeding, we should know what is mean by breast milk. Breast milk is the wholesome food for the baby. What? Breast milk is the wholesome food, the entire, the comprehensive food, the overall food for the baby. Breast milk is the overall food for the baby. Okay, wholesome. Okay, overall is nothing but the wholesome food. Breast milk is the wholesome food for the baby. And next, the definition of breastfeeding. Breastfeeding or lactation is almost similar. We can also call lactation as breastfeeding or breastfeeding as lactation. It is a process. Okay, it is a process of breastfeeding to the baby from mother. Okay, it is like a process. So it is the best way. The breastfeeding is the best way to provide a baby with a caring environment as well as the nutritional needs. Okay, caring environment and comprehensive nutrition. It provides both the caring environment as well as the comprehensive needs, especially the nutritional needs. Okay, the breastfeeding, it also meets the emotional as well as the nutritional needs of the baby. So these are the concept that comes under the breastfeeding. And third definition, we are looking into exclusive breastfeeding. Breastfeeding is different from exclusive breastfeeding. Breastfeeding, all mothers can do breastfeeding to their babies. But the exclusive breastfeeding, whether the mother is practicing or following the exclusive breastfeeding is matters a lot. Okay, exclusive breastfeeding means feeding the baby with breast milk soon after the birth until the 6 months of age without giving any other food other than the breast milk. Okay, this is what the definition of exclusive breastfeeding. So we have seen breast milk, breastfeeding and exclusive breastfeeding, that is these definitions. Now let's know the basics. Okay, before moving to the breastfeeding advantages, disadvantages, let's see the physiology of lactation, how the milks are produced, how milks are ejected. Okay, the physiology of lactation we'll see now. The physiology, actually the human milk is produced due to some interactions between the hormones as well as the reflexes, right? So what are those hormones that are responsible for the secretion as well as the ejection of the milk? Those two hormones are prolactin hormone and oxytocin hormone. And also I said there are two reflexes which are interacted between two things, the hormones as well as the reflexes in producing the milk. The first reflex is milk secretion reflex, which is also known as prolactin reflex. And number 2, which is a milk ejection reflex or oxytocin reflex. Clear? Now let's see one by one. What is milk secretion reflex? These will be like your short answer questions, that is 2-mark questions for you people, either in the examination as well as in the viva. Clear? So let's see what is milk secretion reflex or prolactin reflex. Here the prolactin is an hormone produced by the anterior pituitary gland, which is responsible for the secretion of the milk by the alveoli cells of the breast. Okay, so which is responsible for the secretion of milk by the alveolar cells. In breast there is a alveolar cells, so that are responsible in secretion of the milk. Okay, this is what all about the milk secretion or reflex or a prolactin reflex. Now let's move to the oxytocin reflex or milk ejection reflex. What is milk ejection reflex or oxytocin reflex? Oxytocin is a hormone produced by the posterior pituitary gland, okay, which is responsible for the contraction of the breast tissues. Okay, the contraction of breast tissues leading to the ejection of the milk. So this is how the process takes place. Due to the contraction of the breast tissue cells, the milk will get ejected from the mammary glands, resulting in the ejection reflex or a oxytocin reflex. Clear with the physiology of the lactation? Okay, now let's see the types of breast milk. Okay, so it is also important to know what are the different types of breast milk are there, because these will carry 2 marks in your theoretical as well as your clinical or practical examination viva. Okay, so let's give some importance to the types of breast milk. Actually there are 5 different types of breast milk, starting from colostrum, CTMFH. You can remember with a mnemonic like this, CTMFH, where C stands for the colostrum, transitional milk T, and M is for mature milk, F is for fore milk, and finally the hind milk stands like H. Okay, CTMFH. I do remember like this with a mnemonic, so that it would be more easier for me to remember and also to implement in the exam. If required, you can follow this. If not, you can go with an order like colostrum, transitional milk, and mature milk, fore milk, and finally the hind milk. Always remember that these 5 different types of milk should come in a chronological order, because it follows one by one, starting from colostrum and ending in the hind milk. Okay, so let's see what is colostrum. Colostrum is the milk that are secreted during the first 3 days after the delivery. Okay, so after the delivery of the baby, like after the birth of the baby, the mother breast will be secreting the milk up to 3 days, which is called a colostrum. Okay, it is a milk secreted during the first 3 days after the delivery, but it is thick and yellow in nature. Okay, so it is thick and yellow in nature, which are more rich in antibodies as well as immunoglobulins and also vitamin A, D, E, K. So these are the functions that we can see in the colostrum. And next is the transitional milk. What is transitional milk? It is the milk secreted during the next 2 weeks. Okay, during the next 2 weeks is called the transitional milk. It is also rich in immunoglobulin, as same as the colostrum. And third type of milk is mature milk. What do you mean by mature milk? Here it follows the transitional milk, and also it is also rich in both the fats, sugars, as well as the proteins, energy, everything. Okay, so it is thinner in nature as well as it is watery. When compared to colostrum, it is thinner as well as it is watery. The mature milk will be thinner in nature as well as watery. And the 4th type of breast milk is fore milk. Here itself we can say that fore and hind milk. Fore milk is a type of milk that are secreted at the start or initial period of the breastfeeding. And here the hind milk, it represents that it is a type of milk that are secreted at the end of the breast milk that satisfies, okay, that satisfies the baby's hunger. So these are the 5 different types of milk that comes in a process so that the baby's hunger will be satisfied. Clear? And next we'll move to the initiation of breastfeeding. So when the mother has to initiate the breastfeeding to the baby, so the initiation of breastfeeding should be started or initiated within It's not like we can prolong the period of breastfeed. No, it should be done or initiated or started within half an hour to 1 hour after the delivery, especially the normal vaginal delivery. In case of normal vaginal delivery, the breastfeeding should be started or initiated within half an hour to 1 hour after the birth. Okay, in case of cesarean sections, the breastfeeding should be started within within 4 hours. Okay, within 4 hours, the breastfeeding or feeding the baby should be initiated within 4 hours. So this is all about the cesarean section and normal vaginal delivery, where the breastfeeding should be started. Done. And next we'll move to the techniques of breastfeeding. So there are variety of techniques that it varies from individual to individual. Let us discuss some standardized techniques that could be followed in breastfeeding. Especially those techniques are, first thing is the preparation of the nipples. And the second is like latching or attachment of the baby to the breast, as well as the third technique is positioning both the mother as well as position of the mother as well as the baby. The first one will be the preparation of the nipples, and second one will be the position of mother as well as the baby, and third one will be the latching or attachment of the baby to the breast. These are the three techniques that we follow or that mother has to follow during the breastfeeding. So first one, let's discuss one by one. The first one is the preparation of nipples. How do we prepare, how the mother has to prepare before breastfeeding is she has to roll the nipples, because during a normal position or relaxed position the nipples will be inverted instead of everted. Okay, so the mother has to roll the nipples and then she has to give some massage over the breast so that the stimulation of milk could be more effective in feeding as well to the baby. Okay, roll the nipples and breast massage to be done, and if possible or whenever necessary, try to before feeding as well as the after feeding to the baby, wash the breast with plain water or if required the hot water, anything according to the convenience of the mother. This could prevent the infection that could transmit from the outer surface of the breast to the baby's mouth. Okay, and next the second technique is the position of the mother as well as the baby. So the breastfeeding should not be done however the mother likes, or it couldn't done. Okay, the position should not be changed whenever the mother likes. So it should be in appropriate position. Let's discuss few of the positions that mothers needs to be followed while giving the breastfeeding. Some are the side-lying position, football position, cradle position, as well as sitting position. So these are the positions that mother can follow while feeding the baby, so that both the mother as well as the baby will be comfortable when the mother follows these positions during the breastfeeding. Okay, and third technique is the latching or attachment of the baby to the breast. Here, why we are stressing here is sometimes, since we all know that the baby will not open their eyes immediately after the birth. So the baby that gets attached to the breast or search for the milk, the reason is with the rooming reflex, with the smell of the mother. So once the breast smell, the baby gets it automatically attaches to the breast. The baby gets attached to the breast and it starts sucking out. So in this process, the mother should be more proactively and effectively, she should notice for the good signs of attachment, like the baby's mouth should be wide open. It should not be smallly open. The baby's mouth should be widely open, that covers the areola, entire areola, including the primary as well as the secondary areola. Okay, so these are some good signs that mother should look for, so that the breastfeeding will be effective. Okay, so these are the techniques. Now next let's move to the advantages of breastfeeding, both for the mother as well as the baby. As I said earlier, now we'll go to discuss about the advantages of breastfeeding for the mother. So let's discuss one by one. The main advantage for mother because of the breastfeeding is it helps the mother to lose the weight that she had gained during her pregnancy. Okay, while during the process of breastfeeding, the mother may lose her weight that she had gained during only on her pregnancy, okay, not on the weight that she gained other than the pregnancy. This is what it helps in weight loss, and it promotes involution of uterus. What do you mean by involution of uterus is returning back in a normal position. Involution is nothing but returning back to the normal position. Here the uterus will be enlarged during the pregnancy, so with the help of the breastfeeding processes, the uterus will get back to its normal position. That could be more, promoted by the breastfeeding. Okay, it helps in weight loss, it promotes involution of uterus, and it lowers the risk of breast cancer as well as the ovarian cancer in mother. Okay, this is also an important advantage for the mother. And finally, it promotes the more emotional and physical bonding to the between mother as well as the baby. Okay, clear? These are some of the important advantages of breastfeeding, especially for the mother. And also finally, it lowers the risk of infection to the mother as well. Though it is in the baby, it is also a secondary advantage that could help in mother. Weight loss, and promotes the involution of uterus, lowers the risk of breast cancer as well as ovarian cancer. And the important thing is, during the breastfeeding process or lactation process, the mother will not get pregnant. In the sense, the breastfeeding or lactation serves as a natural contraceptive or contraception by suppressing the ovulation. Okay, so these are some advantages, and also it is very easier or a convenient method for the mother to feed her baby. Okay, so this could be more advantage for the mother instead of using the artificial feeds or formula feeds like that. Clear? And now let's move to the advantages of breastfeeding for the baby. First thing, it promotes and maintains the optimum health and optimum growth and development as well as the health. Okay, it promotes and maintains the optimum growth and development as well as health, which will be a greater or major advantage for the baby, as their immunity is too low during the first initial period after the delivery. Okay, and also it lowers the risk of infection, and it protects the baby from allergy with an antibody, because there should be some fighting agent, that is antibody which is responsible here is immunoglobulin A, IgA antibody. So it protects the baby from allergy, and also it is economic benefit. As I said earlier, it is free of cost. There is no money that a mother has to spend, in feeding the breast, in feeding the milk, that is especially a breast milk, right? So in case if mother uses the artificial feeds or some artificial formulas, then it will be like cost effective. Clear? So economic benefit is also there, and also physiological and psychological adaptation. As I said earlier, the love and affection between the mother and the baby will be promoted. The physical and emotional bonding will be improved when mother starts the breastfeeding. Clear? So it improves or promotes the optimum growth and development as well as the health, lowers the risk of infection, and protects the baby from allergy with the help of antibodies IgA. Okay, and next is it is economic benefit, and also it reduces especially the infection, because the baby is more prone to the infection as the immunity is less, as I said earlier. Okay, and since the thickness of the milk, it helps in digestion, whereas when you start with feeding with co-milk, the baby starts with the diarrhea, everything, because of indigestion problems. Here the breast milk has another property of advantage called it helps with digestion. Okay, it also helps in digestion, and also it provides emotional and physical bonding between the mother as well as the baby. So these are some advantages for the baby because of the breastfeeding that makes the baby stronger, as well as one more important advantage is it reduces the infant mortality and morbidity. What is infant morbidity? Infant morbidity is number of babies that they are suffering from the disease conditions. And what is infant mortality? The number of babies that are dead, the number of death babies is nothing but the infant mortality. Okay, it reduces both the infant morbidity as well as the infant mortality when the baby started with breastfeeding. Okay, so these are the advantages of breastfeeding both for the mother as well as the baby. And next, let's move to the factors, the last topic, the factors inhibiting the breastfeeding. So what are the factors that could inhibit the breastfeeding? Because it is a natural process, how could it could be stopped or inhibited? Yes, there are some factors that are responsible that inhibits the breastfeeding. First factor is psychological factors. The psychological factors includes the mother might be of fear, anger or anxiety, or sometimes a strong pain post delivery. The mother may undergo postpartum depression. Because of that, the mother may not be that much interested in breastfeeding. Okay, so this may be a major factor. And second thing will be like the nipples. The nipples, as I said earlier, it may be a flat nipple, it may be an inverted nipple, sore nipple, cracked nipples. So if these terms or if these are observed in the mother, then it could be a difficult process for the mother to breastfeed to the baby. Okay, so these are the some of the factors that inhibits the breastfeeding, so that mother may difficult in feeding the breast milk to the baby. Clear? So these are the factors inhibiting, and now I have completed all the subtopics that comes under the breastfeeding, or all the important points that covers under the breastfeeding, starting from definition, physiology of lactation, types of breast milk, and definitions of each, like breast milk, breastfeeding, as well as the exclusive breastfeeding and initiation of breastfeeding, and techniques of breastfeeding, advantages of breastfeeding for both mother as well as the baby, and finally the factors inhibiting the breastfeeding. Clear? So these are the important topics or subtopics that comes under the breastfeeding. So if you have any doubts or queries, please comment in the comment box so that it could be cleared in the later classes. Thank you guys. Bye bye.